Houston is closely tied to the development of medicine in Texas, with early pharmacists often combining their practices with medical care. The Texas Pharmaceutical Association was established in 1879, marking a significant step in organizing the profession and improving standards for pharmacy practice in the state. By the mid-1800s, several physicians in Houston operated drugstores alongside their medical practices.
You have an infection, lucky for you, we just got this penicillin in. It will help.
Over the years, pharmacies in Houston have evolved from simple drug dispensing to providing comprehensive healthcare services, including consultations and patient assessments. Today, Houston has a diverse range of pharmacies, from large chains to independent stores, reflecting the city's growth and the increasing complexity of healthcare needs. The evolution of pharmacies in Houston mirrors the advancements in medical practices and the growing importance of pharmacists in healthcare delivery. Over the past several decades, the United States started losing our drug manufacturing capabilities. The first sign wasn't dramatic. It wasn't empty pharmacy shelves or panicked headlines. It was a quiet, apologetic shrug from a pharmacist in a Texas town.
It's back-ordered. It could be weeks, maybe longer.
At first, people adapted. Doctors prescribed alternatives. Pharmacists split doses. The news called it a temporary supply disruption, blamed on overseas production slowdowns, trade tensions, and a factory shutdown halfway across the world. Within months, shortages spread from specialized drugs to everyday essentials, antibiotics, insulin, blood pressure meds. The United States, once a manufacturing powerhouse, had long ago shifted pharmaceutical production overseas in pursuit of efficiency and lower costs. Now, with geopolitical friction tightening and global supply chains fracturing, that efficiency had become fragile. Parents sat longer in emergency rooms with children burning from infections that once would have been quickly treated. Routine surgeries were postponed because anesthesia supplies couldn't be guaranteed. Chronic illness patients, diabetics, cancer survivors, veterans with service-related conditions became unwilling gamblers, stretching doses and hoping their bodies would hold. Productivity dropped as untreated illness rose. Insurance costs spiked. Black markets emerged, first online, then in parking lots. Counterfeit drugs slipped in, sometimes harmless, sometimes deadly. Trust eroded. People began to question a system that could deliver overnight packages and streaming entertainment anywhere, yet couldn't reliably provide life-saving medication. Then the military felt it. Veterans, already navigating a complex healthcare system, were hit hardest. At the VA clinic, appointments grew longer and more tense. Doctors had fewer tools. Pharmacists had fewer answers.
I can switch you to this. It's not as effective, but it's what we have.
Across the country, stories like this multiplied. Veterans with PTSD struggled as medication gaps widened. Pain management became inconsistent. Some turned to alcohol or illicit alternatives. Suicide rates, already a national concern, began to climb again, quietly at first, then unmistakably. Meanwhile, defense planners grew uneasy. Pharmaceutical dependence had become a national security issue. In prolonged conflict scenarios, reliance on foreign manufacturing posed a direct risk, not just to troops abroad, but to the civilian population supporting them. A classified report circulated in Washington. Its conclusion was blunt. A nation unable to produce its own critical medicines cannot sustain long-term military readiness or domestic stability. By the time serious efforts began to rebuild domestic pharmaceutical manufacturing, the cost was staggering, financially, politically, and humanely. New plants broke ground, incentives rolled out, training programs launched. But rebuilding an ecosystem took years. The lesson, when it finally settled in, wasn't about economics or globalization alone. It was about resilience, about understanding that some things, no matter how efficient it seems to outsource them, are too essential to leave beyond our own borders. Medicine wasn't just a commodity, it was a promise. As a result, in 1992, Darcy Pharmacy was formed as an independent pharmacy dedicated to serving the residents of Houston, Texas. Their goal was to produce and supply medicines to the general public, not offered by the large chain pharmacies. In 2007, Darcy Pharmacy and its affiliate were absorbed and became Biocare Pharmacy as a separate and independently operated pharmacy. Over the last 15 years, Biocare has become an active business leader and is recognized locally by the Houston community, throughout Texas and nationally for their service to its customers and veterans all over the United States and those stationed overseas.
As a pharmacist, it has become very clear the difference Biocare has made in my community.
Biocare Pharmacy now reports annual gross profits in the multi-millions. Millions that is derived from the dispensing and sale of medicines, medical supplies, and counseling to patients. Included in that annual gross number are profits from 11 U.S. government contracts directly with the Veterans Administration to source and deliver affordable medicines to the VA and which are sent to veterans all over the country. Most recently, the owners of Biocare Pharmacy have been appointed to the Board of Directors for the National Small Business Association. NSBA is the nation's oldest small business advocacy organization and operates on a nonpartisan basis in Washington, D.C. and throughout state governments. Biocare Pharmacy is committed to all its customers and has established an aggressive plan to ensure that their pharmaceutical needs are currently met now and will be well into the future. Like most independent pharmacy owners and operators, Biocare executives know the opportunity and struggles of the business, like price fluctuations, volatile product supply, PBM audits and considerations, supply chain shortages, customer opinions, high and lows, and never-ending regulations and certification requirements.
The doctors that serve veterans don't necessarily do it for the money. They do it because they care.
We have responded to the opportunities and challenges we have faced by expanding medical and pharmaceutical awareness counseling to all customers and veterans specifically, requesting and be awarded more Veterans Administration contracts to serve more veterans nationwide and those deployed overseas, setting up a full-scale COVID and general vaccination clinic to be used by members of the Houston community and to supplement VA facilities that may have to exceed capacity, providing training and education to veterans interested in a good-paying career in the pharmacy industry, whether that is at Biocare or any other pharmacy, purchasing and operating an additional pharmacy or two that gives Biocare the ability to expand and grow its service area. This allows Biocare to reach out, serve, and counsel many more veterans nationwide and substantially increase our brick-and-mortar capacity. Like all independent pharmacies, Biocare has faced all the challenges created by the PBM oversight. The PBM's withholding of vital reimbursements has crippled the industry and has caused more than 5,000 pharmacies around the U.S. to have to close their doors and slash or file bankruptcy. Fortunately, Biocare has been able to hire and retain a first-class legal team to help overturn the withheld reimbursements and to assist with the limitless audits initiated and prolonged for over 2 years by the PBMs. Biocare has even had to go to court to challenge and fight the misjudged audit results and final findings of the PBMs. In line with this challenge, Biocare has joined and become part of legislative advocacy groups and movements to help get Congress to change the laws governing PBMs to provide more safeguards for independent pharmacies and to keep them from being financially abused by the previously unregulated activities of the PBMs. Biocare has also formed its own nonprofit advocacy organization called Protection for Our Warriors, comprised of veterans around the country, to monitor and fight for a change in the laws that do not currently protect the independent pharmacies and healthcare of veterans. Biocare, like all independent pharmacies, has had a challenge negotiating the purchase of sourced drugs from the manufacturers and wholesalers at prices at which they can make a reasonable profit margin. Historically, wholesalers have not worked with independent pharmacies they consider too small to purchase large quantities of pharmaceuticals at one time. To overcome this, oftentimes insurmountable challenge, Biocare pharmacies have formed and become part of a cooperative buying group called the Good Neighbor Pharmacies to thereby have more leverage in the marketplace and be considered more viable by the wholesalers. The formation and use of this buying cooperative has also helped with negotiating terms, prices, and volume purchases directly with drug manufacturers that typically, and by industry contract, only sell to large chain store pharmacy purchasers. In the pharmacy industry, it is difficult to maintain the community drugstore feel for the customers and to continue to have outreach to the members of the community. Biocare has been able to stay connected to the local community by working to keep the same staff and not suffer from the normal quick employee turnover that is experienced in most of the industry. Biocare has built a family of employees by being careful not to overwork the staff, Pay them each a little more than industry standard. Make sure each employee is known by customers, and working with the local doctors, hospitals, and clinics to create and maintain an effective referral system and provide ongoing long-term consulting to the customers regarding their drug usage, side effects, and continued care. Biocare also participates in and sponsors local community events to stay close to the community it serves. Having had years of experience, good and bad, navigating the challenges of the prescription drug industry, Biocare owners have a sincere desire to find a way to help our fellow independent and chain pharmacies and the communities and people they serve. Biocare has been afforded an amazing opportunity to become a primary pharmaceutical distributor with a newly established state-of-the-art proprietary generic drug manufacturer that is being supported by the U.S. Defense, War Department, the Veterans Administration, and countless large-scale investors. Fortunately, the drugs are all American-made, with U.S.-derived API that is 99% pure, above USP standards, and will be produced in a steady supply that all independent pharmacies and chain stores can count on. Since 1992, Biocare has been a forerunner of innovation in the field of pharmaceuticals, and we plan on staying there. Our main objective is to pass our much lower than retail purchase prices onto our fellow pharmacy owners and operators. For over 30 years, Biocare has been a name everyone, including our military, can trust and count on.
We just have to stop treating our veterans like we do, and thanks to Biocare, and the gaps of care are starting to get filled.